Hi, so I want to talk to you guys about something very interesting today. That is low stomach acid. Now, what is low stomach acid? So, basically, whenever your body isn't producing enough acid in the stomach, that can be called low stomach acid. Now, this usually happens as a result of aging. And the other reason can be the quantity is fine, the amount of acid being produced in your body is okay, but the pH of the acid is not right. So, usually, for your stomach to function properly, the pH of your stomach acid needs to be between 1 to 3. But for various reasons, if this is higher, which means it's not acidic enough, it's actually more on the alkaline side, or it's less acidic, then also the condition is called having low stomach acid, which is hypochlorhydria. Okay, now what are the symptoms of this? So you will be extremely surprised to know that the symptoms of low stomach acid are actually bloating, acid reflux, indigestion, all of this. But usually when these things happen, especially when we get acidity, where do we feel it? We don't very commonly feel it right in the stomach unless we have something like an ulcer or have gastritis, which means that the lining of your stomach has eroded away. So unless you have that, you're usually going to feel it in the upper part, right? Most of us feel it in the chest region. It feels like a hard burn, or it also often that acid comes up in your throat. Correct? Many people even tend to get headaches because of this acidity. So it's usually on the upper side. Yeah. Now, why is this happening? So there is actually a sphincter, a valve that is there between your esophagus, which is your food pipe, and the stomach. Now, this valve is normally supposed to remain shut unless, when we are eating and the food has to pass down to the stomach. Now, this valve, why does it not shut properly? So, again, if there's not enough stomach acid, or if the pH of your stomach is not right, then it tends to be a little loose. And because it is loose, it opens up slightly. That's why that acid reflux happens. Okay. So now, when we have acidity, what do we normally do? We run to antacids, right? We take antacid tablets, syrups, but we have to understand that what this is doing is it's actually suppressing the acid further. So yes, no doubt you have acid coming up, but it's in the wrong place. It shouldn't be here. It needs to be in your stomach. Where it needs to be there, it's not there. But when we take these medications, it keeps suppressing our stomach acids. Okay, and you may feel that relief temporarily, but in the long run, because it has suppressed your stomach acid, you're also going to have other problems. So thanks to your stomach acid, you're able to digest your proteins properly. You're able to absorb your vitamins, your minerals properly. So over a period of time, when it keeps going low, you're not going to digest your proteins very well. You're going to start having a lot of deficiencies in your vitamins and minerals. Your immune system may go down. You may start developing more infections. Okay, so which is why we need to understand what the root cause of your acidity is. You can't blindly go and take antacids and think of that as the long term solution, because it won't. It's not going to give you that long term solution. In fact, it's going to make things worse in the long run. So it's better you identify what is causing that acid reflux for you. All right. Now, why usually we tend to have that low stomach acid? The quantity usually decreases because of normal aging. The pH can tend to vary because of having a bad diet, because of having a lot of stress, various other factors. So it's very important to determine what exactly your reason is, work on that, and solve the root cause of the problem. Hope this helps. Bye.